I am Ehilis. So welcome to this program, Vivid View. Many thanks to God. Vivid View.
Say and close.
Don't start a quarrel when the gun is loaded. Say something, somebody.
My name is Moses Nwosu. Don't start a quarrel when the gun is loaded. I think it's to not start something when you have obvious pointers that you might lose. It will only make you to end up crying over spilled milk. Thank you.
My name is Odedin Ogbenro. Don't start a quarrel when the gun is loaded. Think deeply before taking decision or before jumping to conclusion in any situation you are.
I am Kayode Dane. Don't start a quarrel when the gun is loaded. It could be to not make any decision whenever you are angry. Thank you.
Thank you so much for the contributions. In addition to what you have just said, I think it's just telling us about danger. We should run away from every appearance of danger as youths. For instance, it could just be mere play. Our youths are fond of this. It's common with our youths. You touch your friend, you say, please, I don't like, don't touch me. I'm not in that mood today. The best thing you do is actually to stop immediately, since he doesn't want such play. But if you continue, it could ensue to something different. He could pick something and hit you, and fight, comes down from there. Before you know, somebody's already on the ground. You have killed somebody. Another example I want to give again is sometimes you come in contact as youth again with some police officers or anyone or any of them it could be police, it could be army, it could be whatever, but they have gone. And for any little, maybe this altercation or discussion, they just said, if you don't take, I will shoot you. And you say, shoot me, shoot now, don't even shoot me. You don't need to say that because some of them, you understand. And you just pull trigger. Somebody's on the ground again. Who is going to defend you? It's a report the police officer or the army officer that made that they will listen to. At most, you go for 5 or a few years imprisonment. So any form of danger, it could be even what you eat, it could be what you take in, it could be anything that you know is dangerous, please run away from it. Just to add to what they have just said. Well, enough for this. We'll go straight to the business of today. Regrettably, many people, both young and old, has gone down the grave because of their nonchalant attitude in intakes of drugs or dealing with drugs. Today's topic for discussion is the danger of drugs without prescription. It's time for a break, and when we come back, the guest will be introduced. Please stay tuned. Vivid View.
Say and do it.
Welcome back. In case you're just joining us, the topic again is danger of drugs without prescription. And with me in the studio is a medical personnel. Let's make welcome Dr. Peter Aliwe.
Vivid View. Say and do it.
Before discussion proper, please follow us on social media handles are displayed on the screen. Doctor, you're welcome again.
Thank you so much, man.
Yeah. You're not just a guest today, she's also a sponsor of this program. Can we give you another round of applause? I mean, the company where he manages is also sponsoring this program. So thank you so much for your time with us. Then we'll go straight to discussion for today. Introduction of definition and perspective of what I just introduced.
Thank you so much, man. The discussion we're having today, if you want to look at it, the two key words in the discussion is drug and then prescription.
Prescription, yeah.
All right. So normally when people hear the word drug, they're usually thinking towards just medication. But the word drug is a very broad term. As a doctor, one of the things you do when you interact with patients, whether they come to your office or you go to their ward to talk to them, is to ask them, what medication are you on? All right. Of course, usually it's interchangeable, the word drug and medication. But in the Western world, when you tell somebody what drug are you using, they can be very offended because they'll think that you're saying substance that they're using because of the definition of the word drug.
Drugs.
All right? So,
I got it. Yeah.
So when you look at drug as is being defined, a drug is either a medication or any other substance, all right, that when taken can have the potential or the possibility of having a physiological effect on that organism. So anything you take at all that can change or cause any physiological effect on an organism is a drug. So a drug constitutes both medication and then other substances. All right. So, and it's very important to know that. So I think what we are actually discussing today is medication
aspect of it.
Yeah.
But it can also be, because all of them are intake.
Yes.
You can also have a way of linking them together.
Yes, thank you.
Briefly,
So, for in medicine, for medical practice, we tell everybody abstain from other substances that could have, a physiological effect on you, whether it's alcohol, tobacco, anything at all, they are bad. But for medication, it's very important that you understand what a medication is. Because if you do, then you now understand the reason why you need prescription for medication. All right? Now, medication, when you look at medication, any medication at all that you see maybe or you manage to handle, all right? That medication is used, according to the definition of medication, one, either for diagnosis, all right? So medication is any drug, because medication is also a drug that's used for diagnosis or for treatment or for cure or for prevention of a disease. So once
That's 4 dimensions now.
Yeah, so once you are able to handle any medication, the first question you want to ask yourself is, what is the use of this medication? Is it for diagnosis? That is, do you want to use this medication to know what is wrong with this individual? Yeah. Or is it for treatment? All right. Do you want to use it to treat a particular disease? Or is it for cure? Do you want to use it to cure a particular ailment, or for prevention? Do you want to use it to prevent a particular ailment? And so if you have that concept, all right, ready through your mind, then you know that for you to be able to use a medication properly, that means somebody who is an expert, all right, and also know the medication very well, and also know what your condition is, should be able to tell how you're going to use it. Because you as a normal person can't tell this medication, am I going to use it now for diagnosis? Am I going to use it now for treatment? Am I going to use it now to cure a disease?
Or for
am I going to use it?
prevention?
Yeah. So, and that is the reason why you need a prescription. You see? So a prescription is important because it is the doctor or the specialist that will be able to tell you what this particular medication is going to be used for. Because all medications,
and the dosage as well.
yes, all medications can be used for any of all these things that I just mentioned, whether for diagnosis. Yeah. So, and the dosage, the duration, all right, and the route of intake will determine what you're using that medication for at that particular point in time. Now, so what is prescription? All right. Prescription is a written. So the first thing here is written. So there must be a written. There's nothing like somebody, I called a doctor on the phone and he told me this, and then he says it's a prescription. It's not a prescription. Prescription is a written, authorized instruction on the usage or administration of a medication. So those things must be there. So first is that somebody must have written that prescription, because prescription is a medical document, all right? And the person that gave that prescription or issued that prescription must have the authority. So it's a written, authorized instruction. So a prescription is not complete until there's a clear instruction on what the medication you are being given, how you're going to take it, the duration you're going to take it. Not only that, other advices or what are the possible side effects you're going to have and all that. So that is the concept of prescription. And so it is very key to know that when you handle a drug and there is no prescription, all right, then there's a possibility for you to have issues, because you might be taking it wrongly, and then usually the outcome might not be favorable.
That's where the danger comes in.
Yes, ma'am.
You expose yourself to danger. Before I ask the second question, you just said a prescription must be written. Now you're a medical doctor,
Yes.
for instance, and I am sick and I called you from my house.
Yes.
Say, see, what is happening? I'm definitely going to ask me, what are you feeling?
Yeah.
And then before you come to me, just so and so thing. Can't I go ahead and take, if it's before I visit you, for instance? Because you say it must be written. Yeah. As at that time, it's not written.
Okay. Now,
I don't know if you get my question.
You know, this era whereby you can have telemedicine, virtual consultation. You can call, you can even consult from somebody in the US while you're in Nigeria, right?
Yeah.
Yes, you can do virtual consultation, but virtual consultation only entails a part of the medical care, which will be counseling and all that. The truth is this, is that even telemedicine have its own limitation, because you can't arrive at a proper clinical diagnosis of a patient without a physical...
I just mentioned before I come to the hospital, that could be regarded as first aid.
No. Okay, look at something here. The reason why prescription has to be written is because prescription is a medical document. Now, every single treatment or advice given to a patient in accordance with medical standard must be documented. That's why you have medical case notes for a particular patient, and also which you could get an extract as a medical report. It's very important. So somebody can call you on the phone and say, take 1, 2, 3, 4, 5, 6. All right? But it's not a prescription, because if the person actually has the authority, then the person should be able to be liable to it. So when you take those drugs and there are issues with the drug, so how are you going to come back and say, okay, somebody actually told me, and then these are the challenges?
And of course, in the court, they may ask you, where's the prescription?
Yes, where's the prescription?
But I just use the word as first aid. For instance, I know pregnant women, sometimes when they complain about, oh, I have pains here and there, a doctor could say, you're only permitted to take paracetamol, and then come to the hospital. In that case, at least to cushion the head and not.
That's
exactly what I want you to explain.
Yeah, so there's a difference between prescription and general, advice. For instance, any doctor that is sound or principal in medicine, and then a pregnant woman called you and say,
I'm feverish.
The first thing he's going to tell you, to be frank, is that, have you booked? Where did you book? Who is your managing physician? Yes. Who is your managing physician? And he's going to tell you straight, call your doctor.
In this case, my doctor that I called.
Okay, now. Yeah, your doctor that you call.
Exactly.
Okay, let's look at it this way. Your doctor already knows your history. He's already very comfortable with you. In that situation, yes, some might say, okay, paracetamol is over the counter.
Then come over to the clinic.
It's something, then come over and then do that. But the truth is this, is that at that particular instance, yes, he's doing his best. But you won't say legally what has been issued to you is a prescription. He just advised you on how to go.
You have just answered my question. Okay, thank you so much. All right.
This is VVV.